Welcome back to Beyond the Standard. Today, I'm thrilled to be joined by my colleague, Barb Sylvester. Barb is Director of Regulatory Affairs and Quality here at ACHC. She's also a registered nurse and holds a master's in organizational leadership and quality.
Beyond the Standard is produced by Accreditation Commission for Healthcare. ACHC supports quality improvement and patient safety by offering education and accreditation services that span the continuum of care. The views and opinions expressed on this podcast are those of the speakers and do not necessarily represent official policy or positions of the company or companies with which the participants are affiliated.
Anytime I've got a question about risk management, about quality processes, or even frankly, stress management, Barb is who I turn to. So thank you again, Barb, for being with me today.
Oh, thank you for having me. It's a pleasure to be here.
Yeah. So one thing I don't know much about is your career in nursing and how you came to focus so strongly on the quality aspect. So can you tell me a little bit about that?
Sure. Well, like most young nurses, I started out working in a hospital. I wanted to advance my clinical skills. And then early in my career, I worked part-time second shift because I wanted to work opposite shift at my husband so we could raise our children, no childcare. And then once the kids were school age, I went to full-time and joined home health. I was promoted to management and went for my first business degree because I wanted to be an effective manager. And then my next promotion led me to overseeing the non-traditional community programs and quality and regulatory compliance. I loved the diverse field. I loved it so much, which is why I went back for my master's then in leadership and quality. And I think I witnessed firsthand the part that I could play to affect the care that the staff was providing, and then on the back end, the patient outcomes. I think when you see what an important part that you can play, you feel that you then from then on want to dedicate your career to impacting that quality of patient care. I was very fortunate as my next career move then to join ACHC. That was about 12 years ago. And part of my role now constitutes ensuring organizational compliance and continuous quality improvement.
That that's a great story. And interestingly, I got really interested in quality because I was helping clinical staff at another accrediting organization to develop quality tools for customers. And it's not something that is so specific to healthcare that you can't apply it to almost any aspect of life, really. And so that's how I got really interested in it. Now, because you have oversight of the regulatory team, you have sight lines across all of our diverse accreditation programs. And one of the things that I've noticed, particularly in working with the standards for the different programs, is that all of them, regardless of program, are full of expectations for policies. And I'm wondering, why is that? And how do those policies relate to the broad category of quality?
Yeah, I think policies build a foundation, right? So they provide guidance, consistency, even accountability. Policies lay that framework for what is the expectation? What is it the business needs to achieve, and how are we going to get there? I suppose if you're in quality, you have to love policies, and I do, and I appreciate when policies are well written and our organizations understand the importance of implementing them.
So we not only talk about policies, but we talk about policies and procedures, and we talk about process, and we talk about projects, and we talk about programs. So all of these P's are somehow connected to one another. And it strikes me that they are potentially building blocks. But some of the terms get used interchangeably, and some of them have very distinctly different meanings. So can you talk a little bit about what those differences are, subtle or not, and how they come together?
This is a great question, Angela. And actually, we have customers that ask this all the time. They really want to understand what's our expectation and what's going to be the best tool for their organization. So I think policies are those big overarching tenets for the organization, right? They set some parameters, but basically there's a lot of flexibility in a policy. They really relay the what and the why. Procedures, on the other hand, they explain how. They provide instructions for specific routine tasks. How should that task be done? Procedures have a beginning and an end. They usually follow what is going to be the desired outcome, and they may even include a checklist or process steps to follow. That gets us to that next P, right? So what are the processes? Now, I think organizations interchange a lot of these terms. They might call it a procedure, an SOP, a work instruction, a process. Usually processes, though, look more at a step to step. They look at like a process flow diagram, and that delineates all the steps of that process. Actually, as an accrediting organization, we don't recommend one or the other. If you have a procedure, SOP, work instruction, process, whatever you have that makes it easiest for your staff to understand what needs to be done, it doesn't matter what you call it. I think the really important distinction, though, becomes the next term, and that's the word plan. Because a plan is a little bit different than a procedure or a process. The plan details an action to achieve some specific outcome. So it usually includes timing, resources, what is that objective that needs to be met, and then frequently, how are you going to measure to make sure that objective is met? Probably we are most familiar with like performance improvement plans or emergency management plans or even plans of correction. I think when we look at the standards, though, it's important to know what are the standards asking you for. So the ACHC community-based standards usually start out by saying that policies and procedures are written and implemented, and then on and on and on, right? And in this case, it can be interchangeable. As long as you have a document that's stating what needs to be done, why, and how, you can use any format that you want. And that's why it's written in kind of a broad term. However, for a lot of our facility-based standards, we're more specific. We delineate specifically when do we want a policy statement? Do you know what it is that your company needs done and why it should be done? For all the standards, though, it's important that the word plan is used the same way, that that plan contains all of the elements that you describe what's going to be done to meet that objective.
That makes perfect sense. But I think for a lot of listeners, when you say plan, one of the first things that might come to their mind is a plan of correction. And I know that for the facility-based programs, completing a plan of correction when there have been deficiencies cited on a survey is a big deal. And some organizations struggle with it. And it seems to be the level of detail that we're looking for with that plan that is kind of the pitfall occasionally. But you explained it really well. It's meant to be very detailed and not just say what you're going to do, but who's going to do it and in what time frame and how you will document that it was done. Am I getting that right?
You are, and I'm glad you brought that up because too often when people think about accreditation or having a survey done, they are worried about us coming in and finding a deficiency. That's not what we're there to do. We are there to find the gaps. What is the gap from what the requirement is to what you currently are doing? That's what we are being hired to do, is find that gap. The most important piece of us coming to an organization and doing a survey is the plan of correction. It's not finding the deficiencies, it's the strength of the plan of correction being so tight and so solid that an organization can do nothing but succeed. So that plan of correction, it's not good enough to just simply say that we are going to write a policy. Okay, we have a deficiency or a gap that we didn't have a policy. It's not writing the policy that's the most important piece. It's then implementing it and then educating the staff on that policy and then doing some type of monitoring to make sure that that policy is put in place. And if your plan of correction lists all those things that you're going to do, you can do nothing but be successful with that new policy you've just written. So accreditation is really all about the plan of correction.
And what I just heard you describe is really a quality process. It's the plan, do, check, act
Yes,
process. So that's what we're looking for with a plan of correction, essentially.
exactly. Very well stated.
Yeah. But then there's another piece that we haven't talked about yet that I think maybe is bigger, and that's program. So we talk about in, and I'm speaking specifically in the facilities-based programs, that we expect there to be a quality program, or an emergency management program. And how is that different, or is it?
Absolutely, you're right. Programs are coordination of a number of projects and activities over time, and they deliver a benefit to the entire organization. If you take the example of a quality program in a hospital where there are different departments, and they each need to report about what they're doing, and then they generally report into a committee that integrates all those activities. That way, the plan is comprehensive and more than just a single project, but actually benefits the entire organization.
Once we've established that an organization is going to have a series of written policies and procedures, we then are also asking them to go back and review those on a regular kind of frequency. And what's the point of that? I mean, if you've established a policy, you've established a policy. Why do you need to look at it again?
Yeah, I think regular review is important. You need to stay up to date with your changes. Now, if you think about the policy itself and its premises probably won't really change much over time, which is why it's really good every year or every 2 years to look at your policies just to make sure nothing has changed. But your work instructions or your procedures, they're changing all the time. And for those, the best thing to do is whenever there's a change, go ahead and update your document. That way, those documents can be used for orientation, and they actually will provide that step by step that you want to teach to someone. So, procedures, work instructions, processes, they should really be updated continuously whenever anything changes. But if you don't do that annual or biannual review of your policies, you may not realize that over time there are little tweaks that need to be made. So I encourage us to do that. The one pitfall, though, can be if people write into a procedure that they're going to review a policy every single year, and then that doesn't get done. So you don't want to write procedures that aren't really applicable or that they can't be achieved. And so I recommend that you make a conscious decision of how often do you want to look at those policies.
Yeah. And I think that's something where people get caught fairly often, that um, we're not dictating what your policies should be, but once you've established a policy, our expectation is that you are going to follow it. And so if you say you're going to do something, then we want to see the evidence that in fact it's being done. And if that evidence isn't there, then that could lead to a deficiency.
Excellent point. Exactly.
We have ISO 9001 certification, and I believe we've had it for a number of years now. Did that happen under your watch? And can you talk a little bit about how that decision was made and what the process is? Some background on that?
Sure. Yeah, you're right. ACHC is certified to ISO 9001. And then we say 2015 after we say 9001 because those are the standards when they were effective. And many years ago, before I was here, the decision was made to become ISO certified. And about every 7 to 8 years, ISO updates their standards. And that's why they frequently put the year behind the standard so that it's evident which standards are you compliant with.
Okay.
So like our providers, we undergo a survey ours is every year. So I think by having somebody come look at you continuously, it makes you always ready to have somebody to come into your organization and look at the way you are adhering to those standards. For us, I think one of the most important reasons that we wanted to be ISO certified to begin with was because we wanted to show our consistency. We wanted to make sure that as an organization, whether we accredited an organization in a healthcare organization in Maine or in Tennessee or in Washington, that we had consistency for all of the surveying processes that we do. And as an accreditor, I think that's a really important piece. The ISO standards promote effective, sustainable strategies for us It's a way of doing business. So it's not just simply our quality that we're affecting our business practices and everything from how we deal with risks to how we meet with our stakeholders. It's about meeting those needs and expectations of our customers, of our staff, our relevant interested parties. And ISO keeps us right on target to do that. So I think it's a huge benefit for ACHC or any organization to be ISO certified.
Do you think that do you think it makes us better as an organization that is going out and surveying other organizations because we go through a similar process internally?
I think so. I think that helps us to know what it's like to go through a survey. I
Mhm.
think it also, though, it allows us to educate our customers on what it's like to actually be continuously in compliance. For some of our customers, they actually experience like a fire drill every time we're going to come out and survey them.
Mhm.
And they have to have lots of preparation and lots of education. But it doesn't have to be that way. An
Right.
organization can truly always be continuously in compliance. And because we need to be through our ISO certification, there's a lot that we can teach our accredited customers on how to achieve that. How do you get to the point where your policies are up to date, where you're always looking at risk throughout your company, where document review or chart auditing is something you're continuously doing, so that if you actually have an area of weakness, you know what it is, and you have an action plan in order to improve that area that you're weak in.
The way that I've talked about it with customers is that if you look at the standards as a checklist, I mean, in healthcare, we love checklists. You know, they keep us on the straight and narrow, but then everything is kind of discrete. Everything lives by itself, and it's a task to be, checked off and kind of forgotten. And when you talked about the fire drill, the way that I've spoken about it is it's a flurry of ramp up activities. If instead you look at the standards more holistically as a framework for continuous compliance or a framework for continuous quality improvement, and you see them as a tool, then it just changes your mindset a little bit about how you go about maintaining preparedness for a survey, and maintaining compliance, which is exactly what you were just talking about.
Yeah, those are great points, Angela, and you really understand accreditation very well and what it can mean to our customers. That was very well stated.
I hope that that's what it means for them because I think of us as an education organization and as a quality organization, and I know that it creates anxiety in individuals when the survey team shows up or this individual surveyor shows up, but we're really not there to find fault. I think you said this really well earlier. We're there to find gaps and opportunities for improvement, because we believe that this makes a difference for the patients that they serve, and that's really who we ultimately serve as well.
Yes, absolutely, 100%.
So, Barb, thank you very, very much for your time. I know you are always very busy, and I appreciate you taking some time to talk with me about the P's of quality.
Thanks, Angela. It was my pleasure.
Beyond the Standard is a production of Accreditation Commission for Healthcare, providers of accreditation services for a wide range of community-based healthcare providers, including home health, pharmacy, DemiPose, home infusion therapy, behavioral health, palliative care, hospice, and renal dialysis, as well as hospitals, laboratories, and ambulatory surgery centers. Each episode of Beyond the Standard takes a look at an impactful idea for healthcare provider organizations. We're especially interested in those that help organizations improve as they seek to meet the needs of their communities and the patients that depend on them. ACHC is by providers for providers. Before you go, share your feedback by leaving us a review on Apple Podcasts, and check out our schedule so you don't miss upcoming episodes. For more information about ACHC accreditation, visit achc.org. While you're there, you can subscribe to this podcast and sign up for our newsletters.